Hello everybody, welcome on this Wednesday night to a severe back pain help call. Listen, I know you have to be in pain if you're giving up time on a Wednesday night. I want to be here to give you the information you need so that you can make some intelligent decisions in your life. Listen, I'm not going to be able to see everybody while we're doing this, so go ahead. If you have any questions, just type them into the chat box and we will answer them as we go along. Or if they're still there at the end, I will email you the answers. With that, let's get started. So you probably want to know who this guy is. Well, listen, I've been doing this for over 10 years with all the knowledge, trials, tribulations, success, patient visits, new patients, the results. I've been saving people from bad stuff like Norflex, Tramadol, Percocet, Oxycontin, Oxycodone, and even pain pumps that were inserted into their body due to the fact they were going out of their mind with pain since they were on their way to their fourth back surgery. I mean, it's been incredible what I have seen over the years treating back pain patients. And so, listen, I want to give you the benefit of that experience, and there we go. So, listen, I want you to know you are not alone. There are top 3 most common reasons for a doctor visit. The first one, skin disorders. Second one, arthritis and joint pain. And the third one, that's right, you guessed it, back pain. Back pain is very common, but that doesn't mean that it doesn't hurt. So when you go to the doctor's office, what are they going to suggest to you? Well, there's going to be the top 2 ones, drugs and surgery. We're going to dig into those, give you some information on them, and then introduce a third option to you if you are looking for one. So, first one, stop the drugs! Opioid addiction is rampant in the United States right now. And in the 1990s, when they first came out, the pharmaceutical companies promised everybody that patients would not become addicted to them. Of course, what's that going to do? It's going to lead to widespread misuse of these things. And guess what? We found out they're addictive. Who would have thought? Now, here we are 35 years later, and 187 people are dying every single day from opioid overdose. That's almost 70,000 people a year. So hopefully that's a good reason to stay away from those crazy things. And you might be saying, well, hey, that doesn't apply to me. I don't do those prescription ones. I'm more of the over-the-counter guy. Well, let's take a look at that. The top one, most popular, the non-steroidal anti-inflammatory drugs, that's the Advil, the Aleve, the aspirin. Even if properly taken, they can lead to serious damage of your stomach lining. They can cause damage to your kidneys and affect kidney function potentially for the rest of your life. They can lead to an increase of risk of blood clots, heart attacks, and strokes. Holy crap, do you really want to be taking those things long term? Now, I get it if it's just something for short term, but if you've been having pain for, a month or 3 or even a year or 2, and you're still taking those things, you better be doing some thinking about what you're doing here. Now, you might be saying to yourself, hey, listen, that doesn't apply to me. I'm a Tylenol person. Well, Tylenol causes 56,000 ER visits every year. It's the most common cause of acute liver failure. Whoa! All right. Again, short term, way different than if you're dealing with stuff months or years on into it. Now, you might be thinking to yourself, well, I'm not doing any of that stuff. I'm going to go for the epidural thing. Well, I'm going to give you 7 reasons to avoid epidural injections at all costs. The first one is they're not approved for sciatica or stenosis or bulging discs. They're not even proven effective for these conditions. One shot could cause permanent bone loss. Other side effects include weight gain, cataracts, autoimmune disorders. They weren't created to treat the cause of your pain, and multiple injections can actually lead to spinal surgery. And as a side effect, they can cause paralysis or even strokes. So hopefully at this point, you're rethinking your whole stance on the drug thing. So what does that leave? Well, surgery. And let's face it, there's a lot of people out there saying that, hey, it's an easy surgery. A few days recover and your back pain's going to be gone for good. But is that really the case? Let's look at some studies. So, spinal fusion surgery success is barely 40% in patients. In one study, they did a long-term study, went out a full 2 years. That's not really long-term in my book, but that's what they did. And half of the people that did the surgery said their pain had only been reduced by half. 14% believed they were worse after the surgery. Now, I don't know about you, but if I'm getting cut open, I want something better than that. All right, American Journal of Medicine says that about 80,000 spinal surgeries fail every single year just in the United States. That is an insane number. 20% of the spinal surgical patients have a second surgery within 5 years, even if the first one is considered perfect. Now, nobody thinks that they're going to need a second surgery or a third surgery or a first surgery, but statistics are going to say a very different story. Now, 60% of the people that walk into a spine surgeon's office are going to be diagnosed with a condition that recommends spinal fusion surgery. Doesn't mean they're bad people. They want to help, but all they've got is a knife. And of course, if that's all you've got, you're going to want to use it to help people. It's up to you, the consumer, to decide whether or not that's something that is in your best interest. Look at the spine surgery success probabilities here. So for your first back surgery, 40 to 50% success rate. That means that 50 to 60% of you are going to come out of that saying this wasn't good enough. A second surgery, your success drops down to 30%. Third surgery down to 15%, and a fourth goes all the way down to only a 5% success rate. Wow. So we could go on and on with studies. Let's look at some of the alternatives. So the biggest alternative I want to talk to you about is a technology called spinal decompression. And it's non-surgical. It doesn't use drugs. What we do is we get your body to put the nutrients and the fluids into that disc so your disc can start helping you by healing itself. Now you're thinking, what are you talking about? Your disc is a living tissue. Just like when you cut on your finger, you don't have to do anything to get that to fix itself. Your body does it on its own. Your discs can do a lot of the healing on their own, but they're gonna need some help. Now, what's the success rate of that? Let's look at some studies. So, the Sheely study found that spinal decompression led to a satisfactory pain relief of 88% of the patients. Many of them had failed at other conventional approaches. The author concluded that spinal decompression appears to be the current optimal recommendation for most back pain syndromes. That is huge. Another study by Apfel said that just the restoration of the disc height alone reduces chronic low back pain. That's just one of the things that gets accomplished with the spinal decompression. So, how cool is that? Now, you want to talk long-term studies? We don't have a study that goes out 2 years. We have a study that goes out 4 years. That's right, double that. It's called the Odell study, and it showed that 4 years after decompression, people that had been suffering from chronic low back, 91% were at normal activity levels, and 52% had a pain level of 0. That's nothing, nada, zilch, no pain whatsoever. That is flipping incredible. The results are great, and they can last long term. Now, does decompression help everyone? Well, of course, nothing helps everyone. But remember, your disc is living tissue, and it can help heal it if you help provide some stuff like building the disc up, getting the nutrients into it. Awesome things. Now, what is your roadmap to success if you want to choose this path? Well, the first thing is you got to contact us, because if you don't give us a call or a text or an email, we don't know you've got a problem. We're not going to be able to help you. 402-809-7979. Now, what we're going to do is we're going to set you up for an initial appointment. This is our opportunity to find out more about your history, to figure out when it started, how long it's been going on, what are the things that aggravate it. If you've got an MRI, bring it in. We want to look at those pictures. We want to see what's going on in there. While you're there, we're also going to do 3 major important exams to help us decide whether or not you're a good candidate for our work. Now, once all that's done, we're going to let you go. I'm going to take all that information, I'm going to study it, and I'm going to come down with a personalized plan just for you. Then we're going to bring you back to report of findings, and we're going to go over all of that information, because I'm going to be the first one to tell you it isn't going to be just one visit. All right? You've got some serious problems here. It's going to take some time, and it's going to take some effort. But if you're looking at the alternatives with the drugs and the surgery, it might be worthwhile. You've got to figure out what it is so that you can make that decision. That's why we're going to bring you back for the report. Once you've had a chance to look at all this, to ask all the questions that you've got, to have your significant other here to help you with that decision, then it's your decision, your time to say yes. Then we get you on your road to recovery. And believe me, we want you to get back to feeling normal again. Life is just not worth living if you can't enjoy it with your kids, with your family, going on vacations, doing the fun stuff. That's the stuff that you're missing. All right. Again, thank you so much for being here on a Wednesday night. It's a middle of your week. It's the evening. You probably got way more other things to do, but I want to hope that everybody's got a lot more information that can help them in the future with these big decisions that you have to make. If you have any questions, give us a call or text us or email us. NebraskaBackPain.com. There's a place that you can ask the questions right there, and they will be emailed to us, and we'll get right back to us however you want us to get back to you. Hope you guys have a great day. Thanks for your time you spent this evening.